Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
Extract 1. Questions 1 to 12. You hear an orthoist talking to a patient called Stephanie Cohen. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Let's take a look at you, Miss Cohen. I hear you took a bit of a tumble 2 weeks ago.
A bit of a tumble? Full-on pelt down the slopes, more like it. Would you take a look at this? My leg is all chewed up. I'm surprised I didn't make the local news. I keep hobbling past the TVs at the lodge where I'm staying, hoping word hasn't got out that there's an amateur skier on the loose in Deer Valley, Utah.
You know, I'm sure nobody's even heard about it. This stuff happens more often than you would think, Miss Cohen. Believe you me, in a few days' time, another tumble would have replaced yours. The main thing is, we've got to work on making sure we can prevent this from happening again in the future. Do you remember what actually happened that day?
Yes. I was working on a particularly tricky bend when I lost control and hit someone else in a head-on collision.
Oh, ouch. Well, at least it's straightforward, and we've got no personal medical history to worry about. It's just a straightforward head-on bash.
Right. I'm taking painkillers right now, but is there anything else that I could do to speed things along?
Yes. Allow me to recommend this specialist institution that specializes in rehabilitation for sportsmen and women who've undergone injuries just like yours. I could probably get you seen to this week if you'd like.
Any idea how long this treatment would last?
You'd be looking at approximately 6 to 8 weeks maximum. However, I think the real beauty of the therapy is that they have a support group of current and past patients that you could seek advice from in terms of recovery times, how quickly you can go back onto the slopes, lots of things. Plus, because they have first-hand experience, they really can guide you.
That's all very well and good, doctor, but I didn't come here for that. I came here for a knee brace. The best you've got, or at the very least an assessment for equipment, and not just any old one that will give me support.
That particular one that you're pointing out is currently out of stock. It will be back within the next 2 to 3 weeks.
You'd like me to wait that long?
I'm afraid so. I will, however, keep requesting it until it's here. Let's go over your blood test results, Miss Cohen.
I'm not afraid. Go ahead.
Well, the test confirms our suspicions that you have a grade 2 MCL injury.
I did feel like the whole area was feeling quite tender. At least now it has some sort of explanation. Even though I don't understand it, it's still there.
Yes. Is there anything that you'd like me to go over for you? Anything at all?
No. I really just want to go home now. This is wearing me out.
I'm sorry to hear that. If you just bear with me for another few moments, I'd like to order your unloader brace so that it arrives on time and you can get to working on your healing.
Extract 2, questions 13 to 24. You hear an occupational therapist talking to a patient, Miguel Castillo. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come on in and have a seat, Mr. Castillo. Make yourself comfortable.
Thank you, sir.
You're welcome. Before we start, I'd like to check a few details with you if I can. Your date of birth, please.
18th September, 1981. And I know what you're thinking. Yes, I'm a typical Virgo. Headstrong and resourceful.
All right. What do you do, Mr. Castillo?
Mr. Castillo is what my bankers and lawyers call me. You can call me Miggy, and I'm a bouncer for Voga Clubs Limited. They're the ones who arranged this session for me on an account of my alcohol misuse.
And do you have problems with alcohol?
I don't think I do, but I bet you knew I was going to say that, right? If you ask me, my boss's concerns are misplaced. They should be way more worried about the anxiety I've had since late 2017 than this. At least that was medically diagnosed.
I don't think they'd be concerned for no reason.
No, I guess not. I've been hitting the bottle a lot recently, and I guess it's getting more and more difficult for me to hide it. I have these episodes. I go hard at it for a good few bottles, and I think all that concentrated spirits intakes, it's wreaking real havoc on my gut. You've got to understand, though, I'm surrounded by this stuff every single night. I'd not give a flying fig about Voga's concerns if it wasn't for my family. It's the effect on my responsibilities as a papa that brought me here, not Voga's pretense that they give a...
The head of HR called Miggy. I think they care, and you should give them credit for that. You mentioned your family. How long have you been married?
I'm not. I've been with my partner for 10 years, but I never married her. We've just had a little boy together. He turned 1.5 yesterday, and I love him more than I ever thought possible, even if he looks nothing like me and everything like his mother.
Congratulations to you both. So, back to your employer's concerns. Was it just the drinking?
No, they ranked me over the coals for timekeeping. I can't remember the last time I turned up to a shift on time. It's caused a few rows between me and my immediate supervisor. In fact, the last time got a bit violent. Management's used to the bouncers getting a little aggro from time to time, but I guess they draw the line at violence towards clients.
So there's blows between you and colleagues and customers. Miggy, you know this can't continue. First, we've got to work on breaking the dependency. I spoke with your HR at length, and they've agreed to give you time off so that you can work on yourself. In specific, we're going to go over some coping strategies, which we'll create and rehearse so that you don't have to turn to liquor. There are 2 types of therapy that we use here, and I think that the one that suits you requires us analyzing when you have these episodes, what triggers it. This is called the diagnostic model.
I like the sound of that. I'm keen to get to the root cause of my problems.
Good. Our previous results are very strong. In fact, we've had a 200% success rate that we're very proud of. We'd love to help you too.
That is the end of Part A.